Hello viewers, this is Dr. Kavya, fertility expert, Ferty9 Hospitals, Vizag branch. I am here to tell you regarding the tubal test which is being performed to the infertility couples. Tubes are open or not, there are different varieties of tests which we can advise the patient. First commonly used test is with the help of an X-ray. So we try pushing a dye inside and we take a X-ray to identify whether the tubes are normal or not. That we call it as a hysterosalpingography. Next, other test is during the ultrasound also we will be able to identify the fallopian tubes. So many patients will be asking whether we can see the fallopian tubes in the ultrasound. Normally we won't be able to identify normal fallopian tubes in the ultrasound. If it's an abnormal tube, in ultrasound we will be able to see the tube. So when we are checking for the patency of the tube with the help of ultrasound, we would like to pass a normal saline into the uterus and check the patency of the fallopian tubes with the help of ultrasound. So now in different parts in capital cities like Hyderabad, Bangalore, there is one more test which is available for testing the patency, that we call it as an high COSI, which is not available in normal centers like Vizag. Other tests other than these three tests are when we find tubal abnormality in any of the three above tests. So what we do is the solution will be laparoscopic identification of the tubal patency. When it goes to laparoscopy, it is a surgical procedure. It is an invasive procedure where we ask the patient to come get admitted in the hospital and we give anesthesia. It's a surgical procedure. So where we put a camera into the abdomen and we check the fallopian tubes. If we are identifying an active abnormality in the fallopian tubes, we try to release the abnormality and recheck the patency of the tubes. Sometimes the tubal damage will be permanent and we won't be able to clear the blockade. In those conditions, it will be advised for the patients to go for test tube baby treatments where we do IVF or ICSI for them to help conceive during the treatment parts. So sometimes this tube will be permanently blocked in kind like patient who had undergone family planning procedures. They would like to redo the procedures like reversal operation where they do recanalization procedures. In this recanalization procedures, patients don't check how effective the recanalization has happened. So for the patients who is planning the pregnancy after the recanalization, it is always advisable to recheck the fallopian tubal patency with the help of HSG or ultrasonography. After checking the patency, if the tubes are patient, they can try for the pregnancy 1 year or 1.5 years depending on the age of the patients. So after redoing the surgery like recanalization, if the tubes are not patent, they are not going to conceive without the help of the test tube baby treatments. So in those kinds of situations, we have to check the recanalization successful or not before treating the patients. So this is regarding the tubal patencies. So the patients, what they ask us one more thing is, when one tube is removed or one tube is not patient, can they conceive with the leftover fallopian tubes? If the other fallopian tube is healthy enough, patient do conceive with the single fallopian tubes. There is nothing to worry about a single fallopian tube. Patients do conceive. If you are not able to conceive after trying a period of 3 to 6 months, it is better to consult a doctor for further treatments. Thank you, viewers.